Hi everyone. I hope the light is not so much. Let me reduce the tripod so that it can actually come down. Well, I'm trying to adjust it, but it's rather going up. Oh, okay. Where I'm trying to adjust, that's not the place. Okay. Whoa. Hi. Hi guys. Hi guys. Hi guys. Welcome to. Hey, what is this tripod doing? Okay. Hi, welcome to this live video. Welcome. The place is dry, so I have to moisturize my lip. Okay. Hi. Let's wait for others to join so that we can start this live video. Okay. So first of all, hi, hey Robert Johnson. Thank you for coming. Hi, Robert, kindly tap on the three button on your screen. Tap on the three button on your screen and kindly tap on the three button. You'll see the like button over there. Help me like this video, okay? Help me like this video. It's been a while I came on live. I've been well by God's grace, but I've been busy with work here and there. So today I am live. Thank you, Robert, for liking. Thank you. Please, the person that just joined into, please help me like the video, okay? Like the video. Hi. Hey, Fesan, Sri Lanka. Hey, thank you for liking. Thank you for liking. Thank you for liking. Whoa, my light is getting dim, so I think I should start this video. So, welcome everybody to this live video. Thank you so much for so far 14 of you. I appreciate it. I do not take you for granted. Thank you so much for sharing. Please help me share this video so that more people can join in. Today it's a pharmacy video. We are talking about all we do on this channel is lifestyle and pharmacy, northern lifestyle and pharmacy. Today we are talking about pharmacy, life and challenges of a young pharmacist living in Ghana. Okay, that is our topic for the day. This is a disclaimer. I am not doing this video to make anybody frightened or to discourage anybody from accepting postings to wherever you've been posted to. All entreated to serve our motherland Ghana, and it is necessary for you to accept postings to wherever you've been posted to. Okay, this video, I know more people are going to see the video after this live video, so I want to make it precise and straight to the point. I've listed down some few points here. I want to explain. Do you get it? And shed more light. Oh, my light is going down, so um okay, so I want to explain certain points. If you don't understand, leave it in the comment section or let me see it on the live stream. I would attend to your question. Okay. So first of all, I appreciate all my colleagues. If you don't know, I live in the Upper West region of Ghana. I have lived here for close to 5 years and I've practiced in Upper West region for 5 years now. I've been a pharmacist for 6 years and I have practiced hospital for 5 years now. To the glory of God, I'm almost 5 years in this practice. Okay, so I'm so happy to be sharing this with you. These are some few challenges I have noticed. If there is anyone with any challenge anywhere, I don't know, I want to talk about my personal experience so that if anyone can relate, that is fine. If you cannot relate, kindly skip. No insult, no abuse on this channel. Okay, so my number one challenge is workload. When it comes to pharmacy practice is so much because in district hospitals here in northern Ghana, we have one pharmacist per hospital. Okay, I don't know for any other place, but the region where I live, we don't have many pharmacists. We are just one. So when it comes to workload, we are burdened with workload in a sense that you are the pharmacy manager and you are the pharmacist for the hospital. You are the pharmacist for the district as well. Okay, thank you. Somebody said name a car for an edit. Oh, I don't know. What car do you want to edit for me? Okay. Um, as I was saying earlier, you are one person and you are serving in different capacities. So you are serving as a district pharmacist, you are serving as a hospital pharmacist, and you are serving as a hospital pharmacy manager. You get it. So you must play your role in all these three. You must play your role in all these three areas so that you can function properly. You must have a balance days where you have to visit health centers, CHIPS compound. You must visit the DHA to make sure that if the district director or anyone in charge there, if they have anything to do or if they have anything to say or if they have any contribution towards making the pharmacy practice at the substations relevant, you'll be available for discussion and you'll be available for making input. You get it. Uh-huh. Then as much as you are doing that, you are still the same pharmacy manager for the hospital where you work. So you have to be available for your staff, for your pharmaceutical staff. Yes, they are all part of your job description and you are paid accordingly, but it's still a challenge because if there were other people, you can be doing other things while the person is also taking care of the hospital, or you being a clinical pharmacist, you must as well attend to the pharmaceutical care needs of the patient. So these are the ways you are the pharmacist, you are functioning in different ways. Okay, you have to be available clinically for pharmaceutical care needs of your patients. You have to be available for your pharmaceutical staff as a pharmacy manager, and you have to be available when it comes to your medication and its management. You have to be vigilant and available in monitoring that aspect. You have to also be available. Okay. You have to be equally available when it comes to the the monitoring of the CHIPS compound and that of the sub district. Okay, as I mentioned earlier. So it's one of the challenge. Workload is a challenge. Lack of human resource is equally a challenge. So from the workload, human resource to is also a challenge. Pharmacists are, oh, for some time now, since I came to this region, I think after I came in, another set of pharmacists came in, and from there, I haven't seen any new pharmacists who have been posted. I stand to be corrected. Um, I don't know any pharmacists who have been posted. I think it's a challenge um if the service or our employer is able to employ more people into the system, it will help ease the work. Okay, just like other cadre of staffs are being employed each and every time, our service as well as pharmacists could be made better, or our service as pharmaceutical staff, as pharmacy technicians, as um hospital pharmacists, it can be improved on and can be made better if more hands are employed. I'm talking about employing more pharmacists and more pharmaceutical staff. Okay, so that's our second point. We lack human resource, and the first one is we having lots of workload. Then um my third point, when you are being posted here, my dear, don't be expecting any special treatment or any special. You are here to do your job, and it's your job you are here to do. When you have your appointment, or when you are employed by a private person to manage it, so that might come with a different set of condition. Assuming you are employed by a private person, the person might give you his or his own preferential things to work with, and that is fine. But when you come to working for the state or anything of that sort, don't be expecting anything glamorous. Don't be expecting accommodation. You will not get accommodation unless you are coming in as a manager. If you are coming in as a manager, then you might it's not certain, you might get somewhere to lodge, either for some time or it will be taken care of. But for your appointment coming with accommodation, it's not one of it. Okay, you will not get accommodation. So when you are coming, you have to prepare with your rent at least for 2 years. And let me tell you, we that live in northern Ghana, accommodation is equally not cheap like that of southern Ghana. Depending on the kind of accommodation you want, that's the kind um that's the amount of money you pay. So if you expect a single room self-contained, you cannot just bring any amount. You get it. Or a chamber and hall self-contained with a nice porch, with a kitchen in there, with all sorts of decor. You get it. You have to prepare adequately when you are coming down here, because you would have to do your own payment. Okay, if you come and you get the accommodation, that is fine. But if it's not, let me sit well, if you don't get the accommodation, then you can get your how do you call it, you can get um someone to a place to rent. Okay, sorry. I was reading a comment. So Robert Johnson says, sis, I just need an advice about how to open a pharmacy. I'm not a pharmacist, and I'll need you to introduce me to someone. Thanks. Thank you, Mr. Robert Johnson. The last time, I don't know whether you were the one, I asked you to send me a DM on Instagram at Gifty TV. Kindly do so, okay, so that we can talk better over there. On YouTube, there's no DM. Our conversations will be, if you like it that way, I can link you to somebody or give you the steps as to how to start. Okay, so let's go to our next step. That was our third point. So our fourth point, our number 4, um I don't know how to put this one, but um it all boils down to lack of staff. You get it. If you are a pharmacist that is in an environment, or you are in a facility where you are all alone, you will be, when you are available, assuming you are not on leave or you are in the facility, you are expected to be available every time. When I'm talking about every time, there's no time that you are sleeping. No. Just like when the doctors are needed, do you get it? They are on call anytime there is a need for a pharmacist, you are equally on call. You are supposed to be available. It's not now that assuming the theater or any other place they couldn't stock up or they couldn't come for emergency medications and they need suzametonium or they need thiopentone for general anesthesia for a client or a patient on the table. You are busily sleeping and snoring. Sister or bra, you have to be available of at all times. Okay, that's the meaning of you being on call. You have to be available anytime you are needed so that someone will not die. That is how important our work is. You are not the one doing the surgery, but you are, because you are a pharmacy manager and you are a pharmacist. Okay, if an aesthetic assessment is being done and you are being called, or you are being called, oh fam, what do you think about this patient, how do you see our way forward when it comes to our medications, you must be available. So your phone or whatever means of communication, you must be available for other health staff to communicate with you at all times. Okay, so that is our fourth step. So you being on call at all times, it can be that there are certain times that you want to travel out or you want to go to a different place, but taking into consideration the work, you must factor it in before you go. You cannot just get up and pick your bag and leave. You get it? Exactly. You must take certain things into consideration before you go. So far we have 4 steps. We have 4 challenges. Our first challenge is the workload, we being burdened with more work. The second challenge is lack of staff or lack of pharmaceutical staff. Our third point is lack of accommodation. You will not be given any accommodation or any special treatment when you will get here to deliver your work. Then um our fourth challenge is you being available at all times, even when it's inconvenience, and you must be on call. Okay, to enable the work go on. It's a positive at the same time. It's a negative. It's a positive for the client health and it's a negative for you. Maybe you are in an uncompromised state and you are being called upon to deliver service. You have to go. Yes, you have to go because that is what we've been called to do. Okay, in as much as it's a challenge, it's still a positive because you are needed, you are important, and you have to get up. Okay, so when it comes to life as a pharmacist, let me now chip in life as a pharmacist living in the Upper West region. The Upper West region is part of the Northern region. If you are not aware, it's part of the 5 northern regions in Ghana. The place is okay. How would I describe my 5 years staying here? My 5 years staying here has been cool. It has been peaceful. I've not had problems with anyone, which I thank God for. And when it comes to my work life, I focus on my work and what I am expected to do. Okay. So if I have any challenge, I know the people to call upon when I am challenged, and that is the reason why you must know your bosses. Okay, if you don't know your boss, then it's a big challenge for your practice. Okay, it's a big challenge. So I think I'll come back tomorrow or tomorrow next. We've spoken about challenges of a pharmacist living in Ghana. We will do the advantages of a pharmacist living in Ghana, of a pharmacist that practices in the hospital, okay, in Ghana. Then we'll now do advantages and disadvantages of a pharmacist that practices as a community pharmacist in Ghana. Okay, there are different fields of practice. We've had four disadvantages or 4 challenges. There are more, but I think this 4 is okay. There are other things that we can talk about. Okay, so if you are a young pharmacist and you are being posted here, don't be don't deny the opportunity to serve Mother Ghana because of you thinking of motivations or the advantages. Okay, so I'll talk about that one too in my next video, God willing, tomorrow when I come on live. Please share this live for me. Kindly like this video. Like the video. There's a three button on your left or right. I can't tell which one it is. Please help me tap on the three button. You will see the like button. Then you can kindly like the button for me. Like this video for me. Help me reach, I don't know how many we are. We are 4 on live right now. Help the likes reach 10. Okay. 10 likes, 10 likes, 10 likes, 10 likes, 10 likes, 10 likes. Okay. So far, I think that is it. So far, that is it. Mr. Johnson, please DM me. DM me on Instagram. And please, the pharmacy you are opening, I hope it's in Ghana. If it's not in Ghana, West Africa, then I don't know how I'm going to help you. Okay. So please DM me on Instagram. Help me tap on the three button, like this video, share. Help me like this video and share. Like this video, share. Like this video, share. Like this video, share. I'm waiting for comments, suggestions, contributions, questions. I want to answer your question. Okay, if you're a young pharmacist and you are being posted to northern region, you are being posted anywhere, you want to know why you should practice hospital pharmacy, I am here to answer your question. Okay, give me questions, I'll love to answer you. I'll love to answer your questions. Okay, I'll love to answer your question. Hi. If you have joined this live stream, kindly tap on the three button on your screen. Help me like the video. There's a three button on your screen. Please tap on it. You will see the like button and like this video. Okay, help me like this video. Let's get to 10 likes. So before I forget, let me add the fifth point. When it comes to education, for someone that practices in the hospital, any education, assuming you want to have a master's, any master's you have is not relevant for your promotion. Let me come again. Any how do I call it? Any extra education you have, as apart from you specializing in the Ghana College of Pharmacists or the West African College of Pharmacists, is not relevant for your promotion. But there's a clause there. But it can help you reduce the number of years that you will school, or number of years that it will help you reach promotion. Assuming I'm just a pharmacist, then I go and read masters in clinical pharmacy. Ideally, I have broadened my knowledge. I have learned more. I've acquired more experience. I have more skills. I have more experience now. I should have been promoted because I have an additional certificate. But it's not done like that, okay? It's not done like that. It can you cannot be promoted with on the basis of you having a master's degree, okay? But rather, it can decrease the number of years you would go to be promoted. So assuming you would have gone 5 years to be promoted, at least it will be reduced by maybe 2 years or 1 year. Okay, then when you are going to school, when you present that masters in clinical pharmacy, maybe instead of doing 3 years or 5 years just like any other person would do at the specialty colleges, or the colleges of the West African College of Pharmacists or the Ghana College of Pharmacists, you would rather do less. Okay, so education is also a problem when it comes to pharmacists living in Ghana. When we have masters or anything which is important, which is necessary for our promotion, if we can be promoted with that one, it equally helps. Because if someone loves to do pharmacology, okay, if someone loves to read master's degree in pharmacology, then the person will go and read master's degree in pharmacology and come. You said it's not I'm saying you because so that it's not relevant for your promotion. To me, it's not fair. Do you get it? Others want to be specialists, others want to learn more. So far as it's for serving our country in whichever way the person chooses to serve, I think um it should be, how do you call it? It should be recognized. And when it comes to the specialization too, when you do clinical pharmacy, you are recognized. When you do um public health, if you are a pharmacy specialist in public health, you are equally recognized. But there are other fields that you will not be recognized as a hospital pharmacist. So it's equally a challenge as pharmacists for us. If you Assuming I have an interest in any other field that I assuming I have an interest in reading manufacturing, okay, which is equally part of our pharmacy practice in hospitals as well. If I want to practice manufacturing, if I want to do or specialize or have more broadened knowledge about manufacturing as a specialist, it's not recognized yet. Let me put it that way. We are in March 2025. It's not recognized yet. Maybe soon something will be done about it. So it's one of the challenges we face, so that if someone has an interest in if someone has an interest in reading how do you call it, any other course in the colleges aside public health and that of clinical pharmacy, you would rethink, or you would ask questions, you probe further before you take the bold step in doing that. Okay, you might finish and it's not recognized, and it's just like you having a master's degree in any other field of pharmacy except maybe masters in clinical pharmacy, which would either reduce the number of years you would go for promotion, or it will reduce your number of years at um the college. Okay, so education, I have mentioned workload, I've mentioned lack of human resource, which is pharmaceutical staff. I've mentioned accommodation. You not be given accommodation as a pharmacist who have been posted to duty. No, it's not done. Okay, then the fourth one is you being on call at all times. You have to be on call as a pharmacist. If you are needed, no sleeping, you must be available. You must be available, because your inavailability or your unavailability can cause a patient his or his life. By the time they might refer, or by the time the patient will get the medication, it might be too late, which we don't need that in our facilities. Okay, it's not supposed to be done. You are supposed to be available at every call. If your service is needed or your services are needed, you must be available. Then the fourth one is education. Some of our programs not being recognized to be promoted. And I think that one, it's a major thing, because it must be acknowledged. Yes, most pharmacists have master's degrees in plenty courses, but there are other cadre of staff that their master's degree are being recognized. Okay, so if it's being recognized, we will also, cause if I'm a master in clinical pharmacy, then I think it's almost similar to me being a specialist. Okay, so um these are some of the challenges that we face as pharmacists that practice in hospitals in Ghana. Okay, thank you so much for watching. It's 30 minutes already. I don't intend making this video so long. Thank you so much for watching, and I will see you in my next video. Sorry for my lights, it's went down, but all the same, this video is excellent. Thank you so much for being here. Kindly like, share, follow this channel. Okay, follow this channel if you want more updates about pharmacy practice, everything that concerns pharmacy, and how you're about to come and visit me in my pharmacy. Okay, to come and do business with me. Thank you so much. I appreciate you, and I'll see you, God willing, tomorrow, because we have another live that we are going to be talking about advantages of us practicing as hospital pharmacists. Bye, amigos.